Matt Griffin again here with the Smile Mentor. Today we're closing up a video series on doing your due diligence and really talking about how you can know about a good clinic versus a bad one before you go in. Or at least have as good a chance as you possibly can. In our previous videos, we've already covered how to try to find your local ones. We've talked about the review side of things, how to scrub and understand and what to look for in reviews. And today we're going to talk about social. Social media is a really tricky one. You can find out how engaged and alive a practice is by looking at their social media. Are they proud of their cases? Do they have that pride, and are they showing that off? Are they proud of, do they see their patients as their art? That's one of the biggest things I look for in a clinician. Can I tell that that guy has some art in him, guy or gal, that they have some art in them, that they are an artist, not just a clinician, not just a scientist, but an artist too. And good artists like to show off some of their work. And so looking at social, seeing are they highlighting some of their work? Are they highlighting their smiles that they have? And are they engaging? Are they replying to their public? Do they have the public engaged, and are they sharing? Do they care about their team? I know that this is weird, you're talking about doing due diligence and looking at social media, but do they talk about their team's birthdays? Do they celebrate weddings, births, anniversaries, things like that? I mean, all these things just seem like, is it that big a deal? Again, let's go back to, you're gonna be spending between $40,000 and $50,000 probably on a new smile and set of teeth. Spending a little extra time on this due diligence and kicking some of these rocks over, I promise will pay for itself. But one last point when it comes to the social media side of things, I would look at all their accounts. Now, again, with this kind of, because we're talking about the All-On-X, All-On-4 type of procedure in these videos, a lot of this market is going to be not as Instagram heavy. It's going to be more Facebook heavy. So I would really look at that, but I would look at all their accounts. I would look at all their accounts. How active are they? And then what do they do from an education side of things? So when it comes to the last point that I wanted to make on the social side of things was, how educated of a patient do they want their patients to be? Are they investing in somebody that is doing a good job conveying the message to the public on educating about what they do and how they do it, and what separates them from the pack, and some of their heart and that type of stuff. So these are things that most even clinicians don't think about. And whenever we have one of our meetings with a future client, when we're going to be doing our due diligence on them, even if we're going to just work with them, much less have them trying to fix our mouth. But these are things that we want to look for, because it's going to tell you a lot about them. How do they treat their team? How do they treat their work? How do they treat their patients? Do they reply to them? Do they get back to them? So hope this helps. And again, here's to the next video.